All right, hey guys, my name is Josh Bush, and I'm a member of the Indiana State Doctorate in Athletic Training program. Now, the point of this video is to describe my ideal world for athletic training. So here we go. I'm going to start kind of broad picture, and then I'll narrow it down throughout the rest of this video. But I think that it starts off with just the mentality of athletic trainers in general. We no longer are all on this boat of lack, right? We're all together on this train of abundance. No more negativity, and we're all positive. We all take pride and commitment and ownership within our jobs, and we're all working towards the same goal, which is to continue to elevate our level of patient care across the board. Additionally, we are now aligned with other healthcare professions. The brand of athletic training is now as recognized as physicians and chiropractors and nutritionists and other healthcare professions alike, that when you say the name, you know what to expect. So with athletic training, when you mention that word or that name, anybody that you're talking to is going to picture what they think an athletic trainer looks like, and they're going to picture exactly the services that they expect, and just the relationship that they're going to build with that person. They know what an athletic trainer means, what it stands for, and what it's about. Additionally, now that we've got our brand ready and we're aligned with other healthcare professions, we are able to reimburse for our services across the board in all settings. Additionally, we are working interprofessionally to constantly improve our patient care, right? So if there's something that we're working with a patient that's outside of our scope, we're not scared, and we can swallow that ego that we can't go out and talk to anybody else about our one patient. We're able to share medical information among other healthcare professionals that are able to assist us in in delivering the best patient care that we can get to that specific patient. Outside of that, we're looking at the models that we use within different settings. So specifically within the collegiate and the high school setting, we're using that medical model, right? So we're working under physicians as opposed to being hired directly by the athletic department or having coaches think that they're our bosses or anything like that. We can now focus primarily on what's important and what's right for our patient, and allow them to easily make patient-centered care decisions, because we have educated them and empowered them to make these decisions on their own, and we don't have those outside pressures of the coaches or the athletic program staff or anything like that coming down and influencing our decision. So athletic trainers themselves, right? So now we're getting a little bit narrower. Our focus has shifted from, okay, we're going to be the best acute care specialists that there are, and now we're looking more towards prevention, and we're working with community health professionals, and we're working with injury surveillance and epidemiology, and we all have a good, strong understanding of that with our specific site or with our specific setting, and we can develop and implement meaningful prevention programs that are going to help to eliminate or reduce injury within our populations. That way we can take this mindset away that we're supposed to do all this treatment and all this rehabilitation, when in fact we should be spending more time on trying to reduce the impact that the injury itself has on our population that we're working with. We are documentation experts, right? So we're no longer the ones that we're taught how to write a SOAP note and then that's it. We are contributing to that injury surveillance data and that epidemiology data, and everybody understands the importance of documenting every aspect of their patient interaction. And we have mastered this idea of work-life balance. All of our clinicians are happy, positive, and satisfied within their roles, right? They have a strong sense of identity within their roles. We've reduced the amount of emotional exhaustion that comes with the traditional demands of being an athletic trainer. Additionally, we're now compensated correctly. Since everybody understands the brand and they understand the actual worth of athletic training, we're now able to be valued at that same level of worth. And lastly, we're found in nearly everywhere you look, you're going to see an athletic trainer. Every high school has an athletic trainer that's hired through a hospital or a clinic or some kind of medical model. And then we're found in factories and in industries. We're found working with physicians. We're found working with PTs. We're everywhere you turn, you're going to find an athletic trainer. And that's the dream. So that's my ideal world. Thank you.